All right. Can you guys tell me about your symptoms and concerns before you and the baby had the diagnosis and release?
Yeah, the symptoms were mostly for me. The length of time it would take to feed would be like sometimes an hour plus, but on top of that was like bleeding and cracked nipples. It was extremely painful, and just a shallow latch. So for me, it was mostly just pain that made nursing like unbearable to the point that I wanted to stop.
Okay, goodness. How have things changed since the release for each of you?
Well, it's been great. Initially I was having to use the shield, and shortly after getting body work plus going to Dooling, who's a lactation consultant, we were able to drop the shield at about 4 months. And so I think, all of that plus having the procedure done, like we wouldn't have been able to do that otherwise. And now feedings take like maybe 10 minutes.
Okay. So you went from feeding almost 24 hours a day to
like
10 minutes.
Getting my life back, essentially.
Yes, okay.
And he's overall just like way more content, I think. I mean, he's just always so happy, and that's been the biggest difference for us.
Okay, alrighty. What about the stretches? Because that's every parent's biggest fear and challenge, and they're worried about it going into the procedure.
Right.
What did you guys both think of the stretches, and do you have any advice for parents about that?
For sure. The stretches were not probably my least fun part about it, but I think what was really helpful, especially using you, is that you said, well, call me anytime or come up here anytime, and the fact is, like, you really mean that. I think I came up here probably more than I'd like to admit, but when I just was uncomfortable or not sure I was doing them right, I would just bring him up here. So that was probably my piece of advice, like, really do contact your office if when in doubt. But also you gave me some great videos to watch to help remember how to do them properly. I've watched those videos way many times, and I think you helped too. So, and that was another thing too. Like one of the times I came, you said, get Dad to do them. And so for a while there, I had him do that, which really took.
Yeah, because it's a little hard on the mom at first. Stresses them out a lot, so we found that it was easier if I did it in the afternoons.
Yeah, it takes some of the pressure off of you. You're trying to recover from the birth still,
For sure.
and you've got all the emotion and things going on with the hormonal aspects of that as well.
Yeah.
And to then have to go in and take responsibility and be the sole caregiver for a procedure like that and the rehabilitation that it takes, that's good. And you've had a supportive spouse.
For sure.
And not everybody has that. A lot of husbands don't really buy into this, but they're not the ones breastfeeding and feeling it and experiencing the pain. So at least I don't think they are.
I witnessed it firsthand, though. I mean, everything completely changed. Her whole demeanor. He was happier. She was happier. I mean, it was taking her like an hour and a half to feed him. And then we'd taken the doctor. They're like, well, he's not gaining any weight. So then she would leave there crying. And then, we'd get back home, and when we found out about you guys, like a miracle. So we're very thankful for that.
Well, that's fabulous. That's fabulous. So you had asked for help from the OB-GYN or pediatrician and not found very much.
So my pediatrician didn't really have much help for me. He was going to help me find a lactation consultant, which was great, but so I go to the acclaimed midwife group, and they were able to suggest some lactation consultants, and even Dr. Parker. And so ultimately going to Dr. Parker is where I started for just some body work with him, which was great, but she ultimately thought that tongue tie might be the issue, and she was the one who referred us to you.
Fabulous. What about pain control for him and for you too? You had pain as well. What did you find worked? What did you try? Any advice on that you can give parents?
We did do some frozen breast milk, like you had mentioned, sort of the thin sheets, which I thought was helpful. And honestly, we didn't end up doing arnica. We did do Tylenol maybe twice. But we did a lot of skin to skin, and you know, like after doing stretches, just a lot of cuddle time, but I really felt like, you know, as far as his pain, I really didn't feel like I could be wrong, but I didn't feel like he was in much pain, other than, you know, he didn't really enjoy the stretches, but it really didn't seem to disrupt his, you know, his daily activities. So
Okay,
we really didn't do just a ton of pain management type things.
Not really, just after the stretching, you know, or during the stretching, you know, bothered him a little bit. But usually immediately after, able to comfort him, and he was fine.
Yeah.
And the fact that you know that you're helping him, it makes you feel so much better about having to do it.
Right, doing it for him, not to him.
Yes.
Yes.
Yeah. And that was fun.
What about for you and pain for you? Because you were having to recover and still using the shield some a little bit. And what about for you? Did you find anything that worked? Because a lot of these moms are in your same boat where they're pretty sore.
Yeah. As far as the breastfeeding goes, what my lactation consultant recommended. Their Lansino makes them in their gel soothies, and I would put them in the freezer. And then we would just stockpile those, and I would just rotate through using those. I mean, really, that's what gave me the greatest relief. So, but yeah, putting them in the freezer was awesome.
Okay. Any other advice for parents or tips that you can think of, especially for parents who are on the fence about doing this? And are you happy that you did it?
Oh yeah, for sure. I mean, I think with any decision you make with your kid, just doing the research. I called multiple dentists prior to choosing you, so I think that's the biggest thing. Call around. You know, I'm sure at this point in age you have friends who've gone through similar procedures and get their opinions and on how their process went. But I remember calling our office and asking the front office staff just questions, and just the first impression made a huge difference for us, and so I think that's really it, just doing your research, and we're super glad that we did it and chose you, because it hasn't just been like procedure done, we'll see you in a couple weeks. It's been like an ongoing thing, like you're constantly involved in not just his mouth work, but I mean, you've given us great tips overall to help his overall health. So we're glad we did it.
And we're watching and continuing to monitor several things for him going forward. Yes, and it helps that I'm a general family dentist too.
It does.
So,
yes, for
you know,
sure.
I can take care of everybody.
Yeah,
you know, just general dental needs too.
Yeah.
But because of that and that background, and that's kind of my world and where I come from, there's things about this that apply to that and that we're watching for him moving forward. You're right, it's not just a one and done.
Yeah.
We check him at 6 months like today, again at a year, 2 years, whether you come here or not, you know, that I'm following him, at least him, and his growth and development with this for several years here, so that we can intervene again if we see any other lingering issues. So
yeah, no, we appreciate it. It's been a game changer for us, because we both went into it knowing like breastfeeding was important, but if it were for you, I would have stopped. So
yeah, she was on the verge of stopping.
Yeah,
this was her last.
Yeah. This
last
work, it was out.
So this saved your breastfeeding relationship
100%.
going through the procedure.
And I could, you know, within several weeks, and especially after doing the stretches, it was like the whole structure of like his mouth and his face like changed. The way he opened his mouth, the way he smiled, it was like there was such a vast difference.
It was crazy.
In the before and after. It just blew me away.
Yeah. So that may be one thing that you recommend for parents to do, is to record their baby and how they're moving, opening their mouth, things like that, smiling, playing, cooing before the procedure, so that then they can appreciate the difference looking back on it, you know, weeks and months later. Yeah, because you see and kind of appreciate right when I hand the baby to you, right then the big change with how their lip looks or how their face looks or the tension through the mid-face, but remembering the functional aspects of it and how things change dramatically over time. It's a little more subtle until you really think about it and go back, and having something to go back and look at.
For sure.
Okay, that's a good suggestion and tip for parents.
Yeah, and one more recommendation, and unfortunately I wasn't able to be with Brittany that day, and I believe her mom was. Make sure you bring somebody with you, because it can be difficult.
Emotional support.
For sure, and it was, you know, that day was. But yes, I'm so glad that And I mean, I knew sort of what to expect, but I didn't really. So I'm so glad that she was here.
So sitting alone in here while I'm working, doing the procedure would have been an eternity, as opposed to having somebody with you to support you.
Right.
Yeah.
Absolutely.
Yeah.
So.
And then maybe drive you home so you could sit in back with the baby or what have you,
So
just for your own mental health.
Exactly what we did.
Mm-hmm.
Yeah. And then she stayed the day with me. So.
Yeah. All right. Good advice. Good advice. All right. Thank you guys for your time. I appreciate it.
Thank you very much.
All right.